Hello everybody, I'm Adib, an ortho gamer. Welcome back with interesting topic about diagnosis. Again in orthodontic treatment. Why is diagnosis most important step in successful orthodontic treatment outcome? So let's see. I was in a group, it's like one Telegram group, it's belong to prosthodontist. I have seen the case, one prosthodontist colleagues, he was asking the question about this case. The patient referred to him with this view: posterior open bite, bilateral posterior open bite. And when I asked the history of patient, he told me patients already undergone 3 times orthodontic treatment, 2 times fixed orthodontic treatment, and 1 times aligner therapy. Why 3 times? And this is the result. So they asked the prosthodontist to do the prosthetic job to get occlusion in posterior. I think it's a bit late for this patient to be referred to orthodontist. Why it's so late? 3 times patients gone, spend money and spend years on orthodontic treatment with no result. Why this failure happened? Everything goes back to proper diagnosis in orthodontic treatment. That is the cause of the failure, not the mechanic and not the title of the specialist orthodontist or non-specialist orthodontist. It's all about diagnosis. So we see here asymmetrical arch, posterior open bite, and all of these problems. So after 3 times orthodontic treatment, 2 times with conventional braces and wire appliance, and 1 time with aligners, the final result: bilateral posterior huge open bite. It's really huge. Patient after 3 times long time fail orthodontic referred to prosthodontist to correct the posterior open bite with prosthesis measure. I think it's a bit difficult, and I try to pray for the prosthodontist who is going to treat this patient. God bless you, man. Why this happened? What is the reason behind this? It is called primary failure of eruption. Primary failure of eruption, it's a cause for this patient. It's a rare syndrome, human posterior eruption failure, human teeth, posterior teeth eruption failure. So what is the primary eruption failure, PEF? It's characterized by eruption failure of permanent posterior teeth. The only thing which is very important, and you can make out and differentiate from single tooth ankylosis, it's no mechanical interference, nothing wrong with surrounding tissue of the teeth which is failed to erupt. The way is clear for them, but they are not erupting. No any obstacle, no any interference, nothing. Everything is clear for the tooth to erupt, but it won't happen. And no is well known with genetic etiology. The main cause is mutation in PTH1R parathyroid hormone receptor gene. But as of today, more than 40 genes, they have found that they are related to this syndrome. The main feature is orthodontic force can't move the teeth in occlusion, and it cannot bring the teeth to the occlusion, and the rest of the teeth will move, but not the posterior teeth. So if you apply the force on the tooth which is not moving, what will happen? The other tooth will move. So the force will not lost the way. They just shift towards the main road to the side went road. So the problem will become more if you treat them with orthodontic measure with the wire and forces, because you get the result. It is disaster because you move the you cannot move the target teeth, but you are moving so many other teeth in the wrong direction. And if you apply a bit and little force of wire to your teeth, you will face ankylosis on all rest of posterior teeth. Tooth number 6, tooth number 7, and in the severe case, even your rest of the teeth, like your molars and your premolars, all will affect. So the most of the time we have seen in the case of tooth number 6 and sometimes in tooth number 7, and in more severe cases even 5 and 4, the premolars, they will get affected by this genetic mutation. And key diagnostic features include the teeth fail to erupt even though the eruption path is clear. Orthodontic forces does not produce any movement. Often multiple teeth are affected with progressive pattern. Family history of genetic predisposition may be present, as mutation in the PTH1R gene are strongly associated with primary failure of eruption, PFE. And if we check the radiograph of the patient, and radiographic evaluation shows the teeth position normal within the bone but without eruption progression. So if you take the X-ray time to time, you will see that everything is clear but the teeth are not moving. So we have to be very careful, and we have to do serial X-ray in proper timing and see the patient's eruptions progression. Applying orthodontic force can worsen the condition. That is the thing which I used to tell you. So accurate diagnosis is critical before treatment planning. So how to distinguish primary failure of eruption from other eruption disorder? This is the main point of the topics today which I want to give you. So you may be able to differentiate and find the correct diagnosis and treatment planning upon your patients. Specify for your patients. So in PFE, affected posterior teeth only, molar always, second premolar sometimes, and first premolar very rare. In case of other disorder, affect some or all anterior teeth also, canine, lateral incisors, and central incisors, the main things which you can find useful for you. In any other things, others eruptions problem, you will face problem in almost all the teeth or in not very specified order. But in PFE, you will find them mostly on the molars and the second premolars and overall posterior teeth only. Eruption pathway clear in PFE, no mechanical obstruction. And in other disorder, mechanical obstruction of eruption like ankylosis, eruption pathway block. Affected teeth do not respond to orthodontic force. That is the characteristic of the PFE. But in other kind of eruption failure, teeth respond normally after eruption path is clear, like ankylosis and all. Family history. And the most important one, PTHR1 mutation, is diagnosed. You can take the sample, saliva sample, and send to the lab to do this test for you. The biggest diagnostic problem, one affects first molar, usually mandible. Is it isolated ankylosis or PFE? This is the main problem which make orthodontists to go to the wrong way. They don't know, is it ankylosis or no? If it is PFE, the second molar also will be affected and will not erupt normally. But if it is isolated ankylosis, the second molar will erupt normally. So what do? Extract the unerupted first molar as early as possible. If it was ankylosed, the second molar will drift forward, bringing bone with it. And if it was PFE, the second molar will be abnormal also. So this is also candidate for extraction. So if you do early extraction, in these kind of cases, you don't lost anything, but you gain so many benefit for the patients. You don't need to spend so much boxes money on the 3 times orthodontic treatment. They already, I don't know how to call it. Okay, anyway, we won't talk about it, okay? We just know the patient screwed up badly 3 times. Oh my god. The problem is that the first time they got the failure, but still they tries to do what a man, I don't know, what a madman. Once you got a failure, what you'll get in second time, or what you'll get with aligners. So we have to think deeply. We have to go to the basic again and again and try to understand what is the reason behind these failures. We have to learn from our failure, not again and again repeat it. What to be considered in treating these cases? Do not try to treat them orthodontically. That's the best option for you. Why? The initial minimal force will cause ankylosis. If decide to treat, careful treatment and mechanical plan is required, but I don't suggest anyone to do this. Treatments options: segmental osteotomosis, distraction osteogenesis. In mild cases, maybe you think about these 2 options, and the best one, extraction and implant placement. So here we see some schematic of the cases, a typical open bite in the posterior region. Some interesting articles about PFE 2024 JCO case report. This paper, I like it. Another paper. And thanks to be with me till this time. I hope you enjoyed the lesson. If you want to join my diagnosis and treatment planning workshop in Tehran, 25 and 26 December. This is my number, WhatsApp number. My friends, they will guide you to register to this workshop and do a lot of things about diagnosis. Thank you so much, guys. And here is the topics: clinical examination, record taking, facial analysis, profile analysis, and intraoral analysis, lateral cephalometric, occlusion, and treatment planning after all these diagnoses is done. So we go through all the steps to record the patients, to find the problem, and plan it to treat them. Special orthodontic software introduction, innovation in orthodontic appliance, and my interesting topic, first sagittal approach correction, carrier motion. And at the end we go for hands-on digital diagnosis and treatment planning. By the way, the very, very interesting topics, TMJ and TMD, disc displacement, we will discuss about it. Thank you so much to be with me. I thought this video will be short into 3 minutes, but it's been 14 minutes something. So that means we went deep through the topics. Thank you so much, guys. Have a beautiful weekend ahead. Bye bye, and see you again soon.